This is a pain pump refill in Houston, Texas, Dr. Stefan Gilthorpe's office, Better Life Spine and Pain Center. He's looking right now for the port, and he's using ultrasound device. You can see he's pointing out the port of the pain pump right there. That's how he knows exactly where to inject the medication. So Dr. Gilthorpe performed surgery on this patient about 2 weeks ago. That's why the incision still looks a little fresh. There are 2 incisions in this surgery. One of them is the one you're looking at, about 9 centimeters on the front. That's where the actual pain pump is implanted. Dr. Gilthorpe performs a second incision on the back, which is about 4 centimeters, and that's going to allow for the catheter to stay in place in the spine. This is an outpatient surgery, and then patients go home right after. They come to see us in the office for these sorts of medication refills. This particular patient is probably going to see us about 4 times a year. And the actual device that's under his skin is this right here. That's the pain pump. Dr. Gilthorpe is going to drape the area to prepare to inject that medication. The first step with this patient, because he had surgery so recently, is to drain the pump of saline. Whenever Dr. Gilthorpe does the surgery, he fills the pump with saline. So right now he's going to replace it with some medication that is going to be dripping constantly into the spinal fluid 24/7 to offer hopefully uninterrupted pain relief for this patient. The best thing about these pumps, other than that uninterrupted relief, is that the medication that is dripping constantly is typically at a much lower dose than oral medications. That means less side effects for our patients. There's a much lower incidence of abuse or overdose. And a great benefit that our patients like is that they go home with a device that they can use to boost their medication. If you're having a particularly bad pain day, maybe you slept the wrong way and you just need a little boost of medication, you can use the device that you have to go ahead and send that directly to your spinal fluid. And you can do so safely, knowing that Dr. Gilthorpe has programmed your pump to only allow a certain number of those boosts. As you'll see, these visits are pretty quick and straightforward. The only time they take maybe a little bit longer is if you are not happy with your medication, if you want to change the dosage or try an entirely new medication. There's a lot of flexibility with this procedure. If you've tried everything, epidurals, nerve burns, spinal cord stimulators, and you're just kind of at your wit's end, it might be time to consider an intrathecal pain pump. Just be very careful of who you choose to do this procedure. Make sure that he or she is board certified, ideally has specialty training in this area. We generally have a great rapport with our pain pump patients because they come in for their refills, they're happy, they are satisfied with the way things are going, and are just there for their quarterly refills. We hope this video has been informative. If you have any questions, please leave them in the comments and Dr. Gilthorpe will do his best to answer them. And again, this has been Dr. Gilthorpe's office in Houston, Better Life Spine and Pain Center.